Thanks a lot, and thank you for the honor of being here today. I want to start by congratulating all of you, and especially your families who helped you arrive here today. Today is very special. There are a small number of days in my life that I remember very fondly, and the day that I graduated in this same hall 20 years ago, well, that's the day that I remember very well. And today I stand before you with my three little girls, aged 9, 9, and 6, here in the audience, all born at Mount Sinai. Medicine's a very special career. It's an opportunity for lifelong service. It's an opportunity for daily satisfaction from the contributions you'll make, both big and small. When I was running the FDA, I used to tell my colleagues that we needed to focus on solving problems for everyone, and not only adjudicating individual problems. Now, don't get me wrong, we did a lot of both, but we knew that we couldn't let the individual needs overwhelm our ability to solve problems for the wider population. Yet I'll tell you some of the individual needs that we helped solve and the ones where I played a role, and there were many. Well, those are some of the most memorable things that I did in the job, because the impact on someone's opportunity for a better life was so tangible. If we were able to help a child or a cancer patient navigate the pathway for getting expanded access to a potentially life-saving or life-altering drug, but that was still experimental, well, there were times that the results were dramatic and the impression on all of us was very real. And in the course of your practice, you'll have countless moments to have that kind of direct and tangible impact on people's lives. That's what makes this profession so special. Nonetheless, as physicians, at some point in your career, many of you will be called upon to solve problems on a much wider scale for a much broader population. Medical practice marks entry into an area of specialized knowledge that's very relevant across many fields, but especially when it comes to policymaking. We face many pressing policy issues, as was already spoken about here today. And I know some of you will go on to weigh in on these challenges like I did. Even if you don't take direct roles in shaping public policy, you'll all be faced with contemplating how policy impacts your practice of medicine. And you'll find that your medical training will give you the chance to have a very important and unique perspective on these issues. I want to share with you my perspective on doing that policy work. A few things were very important to me, not only in helping me crystallize my thinking about how to address these challenges, but also in enabling me to find myself in positions inside agencies where I could directly impact the healthcare policy issues. And this is where I was fortunate to have trained at Mount Sinai. It's hard to get noticed for roles in Washington. There's a limited number of positions, and there's a lot of smart and very dedicated people vying for them. What helped me most in having these opportunities was my early work writing about health policy and writing about these matters with a clear and consistent point of view. Clarity in political thought is a critical currency these days. And in Washington, principled people respect clear ideas, especially ideas that may differ than their own. That difference of ideas is actually helpful when you're running a policy process. Knowing the political parameters on a debate helps surface new ideas, and it helps define the left and right boundaries of a solution. Don't be afraid to have a position and state it clearly. That clarity is helpful, and it will define you in a way that can help you shape your policy ideas and have more influence towards advancing towards good outcomes. Now, I was fortunate to publish articles in some prominent journals and newspapers when I was a student here at Mount Sinai, and many more when I was a medical resident here at this same institution. And some of those articles, well, they were edgy. Maybe not edgy by today's standards, but certainly for a medical student and certainly for 1999. I'm sure that the deans here at Mount Sinai, and later my Department of Medicine chief, heard an earful, and it probably went something like this. Why on earth are you letting a medical student publish pointed policy articles on healthcare in the New York Times and the Wall Street Journal, articles I'm sure others might have disagreed with at times? But the leadership here at Mount Sinai saw my writing as part of my broader academic pursuits. They gave me the freedom to pursue these things, and it opened up a lot of doors for me, having that long record of weighing in on policy when I arrived in Washington. My first job in Washington was a year after I left residency. After I finished my residency program, I worked as a senior advisor to the then newly confirmed FDA commissioner. I'd been writing a lot about FDA-related issues, and I was also working for a think tank in Washington after finishing my residency, in addition to practicing medicine as a hospitalist. There are a lot of things that were important lessons I learned along the way, but a few things really stand out and defined how I've tried to work through hard policy issues in my roles. One touchstone that I've tried to maintain is how to forge respect in policy debates. There's a lot I can say here, but there's one thing that I think matters above almost all else. Simply put, it's important not to criticize people directly. It's fine to critique ideas and criticize policy proposals. That's all fair game in a policy debate. But you have to come at it with a belief that everyone who comes to these things has similar motives. Everyone wants to try to advance public health goals and improve the system for patients and consumers. It can be hard at times, given how deeply divided these discussions can come and how shrill sometimes the criticism can be. But most people who spend a lot of time working on health policy didn't come to it because they want to make the system worse or harm patient care, no matter how much you might disagree with their point of view. The minute that assumption of good intent breaks down, that's when the opportunity for thoughtful debate dissipates, and people remember those personal attacks, those jabs stick. A final lesson I learned is that you need to have humility about the limits of what you can do through health policy. We learned this a very hard way through the epidemic of opioid abuse and youth addiction to nicotine and vaping. Despite our best efforts, at some key points we found ourselves tragically behind when it came to more forcefully addressing these burgeoning crises. We had imperfect information about the scope of these addiction tragedies at some critical junctures, and even after we gained a firmer understanding of the tragic breadth and impact of these epidemics, some of our policy remedies took too long to implement and have their full effect. To address big public health crises, you need to be willing to act aggressively, especially in the face of an expanding public health threat, and sometimes act on the basis of imperfect information. You need to act decisively to get ahead of these problems. But you also need to be willing to admit that the impact of policy actions can be slow and limited. You need to build those challenges into how you measure problems and how you aim to address them. I was sad to leave FDA last month, but proud of what my colleagues and I did together during our time at the agency. And I'm not sure there's too many things that I'd want to have done differently in that time. We took on hard issues, we pursued meaningful policies, we flexed our regulatory muscle with strength when consumers were put at risk, and we stayed true to the science-based decision-making that carefully guides the FDA's work. There are a bunch of people from Mount Sinai working at the FDA. My principal deputy commissioner was a Mount Sinai alumnus, and there are a number of senior professionals in the agency's medical product centers who trained here. I don't think that's by coincidence. Mount Sinai has always inspired an exceptional call to service and a unique privilege of service to others. We're in an age when science-based institutions, both public and private, sometimes find themselves under intense scrutiny and criticism from all spheres. But the FDA remains singular among bodies in my observation. It enjoys broad bipartisan support in a fashion that few other agencies can lay claim to. That's a reflection of its commitment to its mission and the careful science-based manner in which it does its work. Your medical training gives you a firm foundation to make those same important contributions, and the culture of Mount Sinai inspires that ethic. It's been a wonderful 20 years since I sat in this hall as you do today. I'm proud of the foundation of service this institution inspired me, and I'm proud of the public health things I've been able to do since I've left, and you all share those same traditions, and I'm confident we'll go on to do many more great things. Thank you.